Welcome to our deep dive. We're going to be looking at, neck problems in warm bloods.
Okay.
And we're going to be looking at some research on radiological abnormalities that happen in the cervicothoracic vertebrae.
Right.
So specifically, we're talking about a 2024 article by Dyson et al., and it's published in Veterinary Radiology and Ultrasound.
Right.
The name of the article is Radiological Abnormalities of the Cervicothoracic Vertebrae in Warm Blood Horses with Primary Neck-Related Clinical Signs versus Controls.
Got it.
So we want to know, like how prevalent are these abnormalities in horses that have, issues with their neck versus horses that don't. So Can you tell us a little bit about this study?
Sure. So this study was a prospective cross-sectional study.
Okay.
And they used a pretty good sample size of 223 warm bloods.
Wow.
And
that's a lot.
Yeah, they split them into two groups. So they had 127 horses that were controls. So those horses didn't have any neck issues. And then they had 96 horses that were considered cases. So those horses had some sort of neck-related clinical sign. So that could be neck pain or stiffness or even ataxia.
Oh, wow. Okay, so they really wanted to look at...
Had a pretty good spread.
Okay, so what did they do with these horses?
So each horse got a standardized clinical exam.
Okay.
And this was to basically assess their net. So look for pain, look for neurological deficits.
Right.
They also did a radiological examination of their cervicothoracic vertebrae.
Okay.
And so basically what they wanted to do was compare the findings between the control group and the case group.
And so they were looking for abnormalities.
Yeah, exactly. More prominent in the case group.
Yeah. Okay. So what did they find?
So a couple interesting things. One was that the cases were significantly more likely to have severe modeling of the articular processes.
Okay.
At C7T1.
So can you kind of break that down for us? What does that mean for people who aren't, as familiar with the anatomy?
Sure. So articular processes are these bony projections that are on each vertebra.
Gotcha.
And they're really important because they form the facet joints, which allow the spine to move.
Okay.
And so modeling refers to this enlargement of the articular processes. And usually it's, abnormal. It's due to changes in the bone structure, maybe in response to stress or injury.
I see.
So the fact that they saw this more in the horses with neck issues suggests that there's something going on at that C7T1 junction that could be contributing to their clinical signs.
And so when you're saying modeling, it's it's getting bigger, basically.
Yeah, it's getting bigger and it's changing shape.
I see.
Yeah.
Okay.
So, it's an important area to look at when we're, dealing with these horses.
Okay. So this is a really important takeaway, I think, for people who are listening, is that, we should be looking at this area.
For sure.
If we're seeing a warm blood that's having neck problems, we should be checking out that C7T1.
Yeah.
All right. So let's move on to the next finding.
Okay.
So this one was spondylolisthesis.
Right.
Now, I've heard this before, but can you tell us what it is?
So spondylolisthesis is basically where one vertebra slips out of place compared to its neighbor.
Gotcha.
And so in this study, they found that the cases were significantly more likely to have spondylolisthesis at C6, C7, and C7T1.
So again, that same general area.
That same junction.
Yeah.
So again, makes you think that's kind of where a lot of the problems are starting.
Right. Yeah. And so what implications does that have for the horse? Why is that?
Yeah. So basically what happens is, if you have that misalignment, it can alter the biomechanics of the spine. And so that can lead to, pressure on nerves, pressure on the spinal cord, pressure on the facet joints.
Gotcha.
And so that can manifest as, pain, stiffness, even neurological signs.
Wow. Okay.
Depending on how severe it is.
It's a lot of problems there. All right.
Yeah.
So we've talked about enlarged articular processes. We've talked about spondylolisthesis.
Yep.
What else did they find?
So they also found that cases had a higher frequency of intervertebral disc issues at multiple levels.
Okay.
So, that includes things like alterations in the disc space.
Okay.
Potentially indicating that there's some degeneration there.
Okay.
And then they even saw some discospondylosis.
Oh, yeah.
Which is basically arthritis of the spine.
Okay.
And so they saw that more frequently at C6, C7, C7T1.
Oh, wow.
And even T1, T2.
So again, same area.
Right.
Yeah. Okay. Interesting. So we're seeing kind of this like common thread through all these findings.
Yes, for sure.
What is that?
So it seems like the cervicothoracic junction is like a really important area.
Okay.
And it's prone to all these different abnormalities,
Okay.
which can then lead to a lot of the clinical signs that we see.
Yeah.
So it emphasizes the importance of looking at this area
Okay.
radiographically
Right.
when we have a warm blood with neck issues.
So it's not enough to just like look at their neck.
Exactly.
We got to look at that cervicothoracic junction as well.
For sure.
Okay. So what other interesting things did this study find?
So they also looked at the sagittal ratio,
Okay.
which basically reflects the size of the vertebral canal
Okay.
where the spinal cord lives.
Gotcha.
And they found that the sagittal ratio of T1 was smaller
Okay.
in the horses with neck issues.
Okay.
And this was especially true for those that had neurological dysfunction.
So that means that there's less space for the spinal cord, basically.
Yeah, exactly.
Okay.
And so, that could lead to spinal cord compression,
Right.
which can then cause those neurological problems.
Gotcha. Okay. So that's another thing to keep in mind.
Yeah,
All
for sure.
right. So we've covered, enlarged articular processes.
Yep.
We've covered spondylolisthesis.
Right.
Intervertebral disc issues.
Yep.
This sagittal ratio.
Right.
Anything else in this study before we wrap up part one that you think is really interesting that our listeners should know?
Yeah, a couple other things. So they found that horses with neck issues were more likely to have a spinous process on C7,
Ooh,
which is kind of unusual.
interesting.
And then they also emphasized the need to look at the first ribs
Okay.
really carefully
Okay. Why the first ribs?
in horses with forelimb lameness.
Okay. Why the first ribs?
Because abnormalities in the first ribs can also contribute to neck problems.
Oh.
Because they're so close together anatomically.
So it's
Right.
Everything's connected.
connected. You can't just look at one thing in isolation.
Exactly.
Okay. So very holistic approach.
Yeah.
All right. Well, we've covered a lot in part one here.
We have.
We've learned about these key findings of this study, which
Yeah.
I think is groundbreaking.
Yeah.
So stay tuned for part two. We're going to be exploring the implications of these findings in more depth.
Welcome back to our deep dive on these, abnormalities in the cervicothoracic vertebrae.
Yeah. So we've been talking about how like these abnormalities are leading to like, neck pain and stiffness and even forelimb lameness in these warm bloods.
Yeah. And they found that there's a pretty strong association between spondylolisthesis,
Yes.
that vertebral misalignment,
Yeah.
and discospondylosis.
Right. Which is basically like spinal arthritis.
Yeah, exactly.
So it's like the instability is leading to
Yeah.
degeneration.
Exactly.
Right.
Makes sense.
Yeah. I think what's really interesting is that, they really highlight the importance of like
Right.
taking radiographs
Yeah.
in these warm bloods with neck issues.
Yeah, for sure. And actually including those cranial thoracic vertebrae, not just the cervical.
Not just the neck, but like
Yeah.
looking at that whole.
That whole junction?
Yeah. Okay.
Yeah.
So what do you think this means for like vets and horse owners?
Well, I think early detection is huge.
Yeah.
If we can catch these things early,
Right.
we might be able to manage them better and prevent them from getting worse.
Yeah. So how do we do that?
Well, so I think for vets, we should be really incorporating, a thorough evaluation of that cervicothoracic junction
All right.
into our lameness exams and our neuro exams.
Okay.
And then for horse owners, just be aware of like the subtle signs,
Yeah.
So if your horse is stiff, if they're reluctant to bend,
Right.
if your performance is changing, those are all things that could indicate a problem.
Yeah. Okay. So early intervention is key.
Yeah, for sure. And I think, they also mentioned that it's important to think about the first ribs.
Yeah. I always forget about those first ribs.
Yeah, they can be kind of overlooked.
Yeah.
But, they're so close to the brachial plexus
Right.
that, if there's something abnormal there, it can actually mimic
Okay.
or contribute to like a neck-related lameness.
Wow. Okay. So we really can't forget about those first ribs.
No, you can't.
Okay. Interesting.
Okay.
So now let's get into like the
Yeah.
big question.
Yeah.
Like, could these abnormalities be genetic?
Right. That's the million-dollar question.
Yeah, because they did mention that,
Yeah.
the horses with the neck issues were more likely to have the spinous process on C7,
Right.
which is like an anatomical variation.
Yeah, exactly.
But like, And they also said that there wasn't like a clear association
Right.
between these abnormalities and like breed or height.
But,
Right.
this study was specifically on warmbloods.
Right.
So it's possible that other breeds,
Yeah.
might be different.
Could be totally different.
Yeah.
Yeah. I mean, it seems like management could play a role too, right?
Perfect.
Like if they're not being trained properly or if their saddle doesn't fit right.
Yeah, like all those things
Yeah.
can affect their biomechanics and,
Right.
could contribute
Yeah.
to these problems.
So it's like multifactorial.
Yeah, definitely.
But this is like a good starting point for
Yeah, I think so.
future research and
Yeah.
hopefully,
Yeah,
helping these horses.
absolutely.
Yeah. So this has
been really interesting.
been a really great discussion.
Yeah.
So that wraps up part 2 of our discussion. Stay tuned for part 3, where we're going to get into the practical stuff.
All right. Sounds good.
So welcome back to our final part. We've been talking about all these abnormalities and what they mean.
Right.
But now let's get into what can we actually do about it?
Yeah, so now that we know about all these, potential problems in that cervicothoracic junction,
Yeah.
let's focus on what we can do to prevent them and then also how to manage them if they're already there.
Okay, cool. So let's start with prevention.
Okay.
What can horse owners do to minimize the risk of their horse developing these problems?
Well, one of the most important things is proper training and conditioning.
Okay.
We need to make sure that these horses have strong back and core muscles
Okay.
to support that spine
Okay.
and reduce the stress on those joints.
So encouraging the horse to really use their back properly?
Yeah, exactly. We want to, develop that top line
Okay.
and just make sure they're strong and flexible
Right.
throughout their whole body.
So a good variety of exercises.
Yeah, for sure. So, basic flat work, hill work, cavaletti,
Okay.
all that good stuff.
And what about the rider?
Yeah, the rider plays a big role too.
Sure.
We want a rider that's balanced,
Okay.
independent,
Okay.
and not interfering with the horse's movement.
Yeah.
Because if you're pulling on their mouth or bracing,
Right.
you're putting a lot of stress on that neck.
Okay, so it's really a partnership.
Yeah, definitely.
Okay. Now what about saddle fit?
Oh, saddle, it's huge.
Yeah.
If the saddle doesn't fit right,
Right.
it can create pressure points, restrict movement,
Okay.
and really contribute to back pain.
So we got to make sure that saddle fits.
Oh, for sure.
Okay.
Yeah.
Anything else that horse owners should be thinking about?
Well, keeping your horse at a healthy weight is important too.
Oh, yeah.
Those extra pounds
Right.
put a lot of strain on the whole body.
Just like in people.
Exactly. And of course, regular vet checks are always a good idea.
Especially with warm bloods, it seems like.
Yeah, especially with warm bloods.
Yeah. Okay. So now let's talk about management.
Okay.
So what if a horse, has already been diagnosed with one of these conditions?
Well, it really depends on, how bad it is and what exactly is going on.
Okay.
But usually we're going to use a combination of things.
Okay.
So controlled exercise,
Okay.
maybe some manual therapies like chiropractic or massage,
Okay.
and sometimes even medication.
Okay, cool. So let's break those down a little bit. What do you mean by controlled exercise?
So basically, we want the horse to move enough
Okay.
to stay flexible and strong,
Okay.
but we don't want to put too much stress
Okay.
on that area.
So it might look different.
Yeah, it's going to be different
Yeah.
for every horse.
Okay.
Some horses might just need a modified riding program.
Okay.
Some might benefit from in-hand work.
Okay.
Some might even need to swim.
Okay. Interesting. So it's really tailored.
Yeah, it's very individualized.
Yeah. Okay. And then you mentioned chiropractic and massage.
Yeah, so chiropractic can help with those joint restrictions,
Okay.
get things back into alignment.
Okay.
And then massage can help relieve muscle tension
Okay.
and improve circulation,
Okay.
which helps with healing.
And then sometimes medications are needed too.
Yeah, sometimes. So NSAIDs are pretty common.
Okay.
But, we might also use things like corticosteroids
Right.
or muscle relaxants,
Okay.
depending on the situation.
So it's really like this multimodal approach.
Yeah, exactly. It's not usually just one thing.
Yeah.
Yeah.
And it's not a quick fix either.
No,
Right.
definitely not. These are usually chronic conditions, so
Okay.
they require ongoing management
Okay.
to keep those horses comfortable.
So you really got to be committed.
Yeah, it's a commitment
Yeah.
for sure.
Okay. Well, this has been really fascinating.
Yeah, it's been a good discussion.
So we've learned a lot about these radiological abnormalities in the cervicothoracic vertebrae of warm bloods.
Right.
And I think, the big takeaway is that it's really important to understand this area and to, catch things early and to work with your vet
Yeah.
to, manage these issues properly.
Yeah.
So I hope our listeners learned a lot.
I hope so too.
And yeah, thanks for joining us.
From Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.